Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about America's health paradox, understanding why we're getting sicker. The troubling evidence, declining health trends. The data presents a sobering picture. For decades, US life expectancy consistently lagged behind other high-income nations. Before the COVID-19 pandemic, had already begun to plateau and even decline in some years. The pandemic significantly exacerbated this, causing a notable drop in US life expectancy from 78.8 years in 2019 to 76.4 years in 2021. While there's been a slight rebound, we remain below pre-pandemic levels. This decline is not solely due to COVID-19. It's also attributed to rising drug overdose deaths, suicides, and the growing burden of chronic diseases. In fact, despite spending significantly more on healthcare per capita than any other high-income country, the US consistently ranks lower on many key health indicators. The chronic disease epidemic. One of the most glaring pieces of evidence is the surging prevalence of chronic diseases. Approximately 73.6 of adults aged 20 and over in the United States are either overweight or obese. This breaks down to over 42.4% being obese and roughly 31.2% being overweight. As of 2022, approximately 11.6% of the US population, 38.4 million people, have diabetes, and approximately 38% of the US adult population, or 89 million people aged 18 years or older, have prediabetes. Cardiovascular disease. While some cardiovascular mortality rates have seen historical declines, the burden of underlying risk factors like hypertension, obesity, and diabetes remains high or is even increasing in younger populations. Non-alcoholic fatty liver disease. This condition, often linked to metabolic dysfunction, is becoming increasingly common due to the rising rates of obesity and diabetes. Behavioral health in crisis. Beyond physical ailments, the US is grappling with a severe behavioral health crisis. Mental illness. There's a significant and growing prevalence of mental health disorders. For instance, in 2023, approximately 22.8% or 57.8 million of US adults had a mental illness. This includes rising rates of anxiety and depression across all age groups, with young people being particularly affected. Drug overdose epidemic. We've been enduring an ongoing opioid crisis with drug overdose deaths reaching unprecedented levels. In 2023, there were over 107,000 provisional drug overdose deaths in the US, primarily driven by synthetic opioids like fentanyl. Suicide rates. Suicide rates have also shown concerning increases in recent years across various demographics, reflecting profound challenges in mental well-being. The reasons. Reason number one, dietary and lifestyle factors. Poor diet. The widespread consumption of highly processed foods, sugary drinks, and unhealthy fats, coupled with insufficient intake of fruits, vegetables, and whole grains, is a primary driver of the obesity and diabetes epidemics. These empty calories contribute to weight gain and nutrient deficiencies. Physical inactivity. A pervasive sedentary lifestyle with less physical activity integrated into daily routines exacerbates the risk of obesity, metabolic syndrome, and other conditions. Our modern lives often discourage natural movement. Reason number two, healthcare system challenges. Our healthcare system itself presents significant challenges. Access to care. Despite high spending, millions of Americans lack adequate health insurance or face high out-of-pocket costs, creating substantial barriers to primary care, preventative services like screenings, and timely treatment. Focus on treatment over prevention. Historically, the US system has excelled at acute care and managing advanced diseases, but it underinvests in proactive prevention and public health. Fragmented care. The system can be disjointed, leading to a lack of coordination between different providers, potentially resulting in misdiagnoses, duplicated tests, or suboptimal management of complex conditions. Cost of medications. High prescription drug costs can force patients to forego medications, leading to poorer health outcomes. So, reason number three, socioeconomic determinants and disparities. Health is deeply intertwined with socioeconomic status and societal structures. Income inequality and poverty. Poverty is a direct determinant of poorer health. Low income individuals often face limited access to nutritious food, safe and stable housing, quality education, and secure employment, all fundamental drivers of health. Lack of education. Lower educational attainment is associated with reduced health literacy and less engagement in healthy behaviors. Food deserts, swamps. Many communities lack easy access to affordable, fresh, and nutritious foods, food deserts, while being saturated with unhealthy processed options. Reason number four, systemic racism and disparities. Systemic racism and discrimination significantly contribute to health disparities, particularly impacting racial and ethnic minorities. This is tragically evident in areas like maternal mortality. The US has a high and increasing maternal mortality rate compared to other developed nations. Crucially, Black women are approximately 2.6 times more likely to die from pregnancy-related causes than white women. This disparity exists regardless of income or education level, highlighting the impact of systemic factors on healthcare access, quality of care, and exposure to chronic stress. Broader disparities are seen in rates of chronic diseases, access to quality care, and disproportionate exposure to environmental hazards. Conclusion, a multifaceted challenge, a shared path forward. The picture of Americans getting sicker is not a simple one. It's a complex interplay of individual choices, profound systemic challenges within our healthcare system, deep socio-economic inequalities, and persistent issues of systemic racism, environmental factors, and an underfunded public health infrastructure. Addressing this national health challenge requires a multifaceted and collaborative approach. We must work towards solutions that empower individual healthy behaviors. Reform our healthcare systems who prioritize prevention and equitable access and address the root cause of socioeconomic disparities and systemic racism. Thank you again for listening to this talk. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you again for